Hi Rajesh, glad to meet you again. I know it's been a while since we connected, so we thought we'll just have a good old conversation about what's changing in healthcare.
Absolutely. Manu, good to see you, and you're spot on. The rapid changes we see in the ecosystem we operate, we're just trying to be nimble to stay relevant to our customers.
So let's dive right into it. What do you think are the biggest things that are shaping healthcare as we speak? And I know this could be a long conversation, but if I were to ask you to pick your top ones.
So if I take the two or three top ones, which is what we're dealing with, one is the whole spectrum of regulations, and the changes to regulations and how it affect members. Linked to that, the second element is capital allocation.
Hmm.
How do our clients allocate capital to which segments of the business to protect their members who we serve? So that is one. And the third link to the members is how do we create customer journeys that ensures that the lifetime value that is unique to the member is clearly reflected within our customers. So these are the three big legs of the stool that we are always grappling with and trying to figure out what is the best fit we can help our clients with.
So you mentioned the first one is regulations. We saw the big beautiful bill. We know some of the spending cuts that are coming up. Medicaid is going to have some of those things to bear. We also saw a lot of the changes that are happening on the Medicare side, right? The utilization rates are skyrocketing. CMS has a lot of changes in terms of redetermination. That's going to kick off this year. As a result, we also saw a lot of health plans starting to reevaluate in terms of what products, what plans, what markets they want to operate in. So how do you see your customers handling these regulations, and what are their biggest reactions?
And one thing common is the level of uncertainty is high, which is where, exactly to your point, the capital allocation as to how do you deal with the various constituents between CMS, between the changes which are coming through, the big beautiful bill, which is, if suddenly 12, 15 million Americans are going to become uninsured in the market, what's going to happen to the healthcare provider network, the pressure that's going to come on the provider network in terms of reimbursement rates that go through there. So, at this point in time, the only focus we have in this world of uncertainty is to ensure that the lowest common denominator in this equation is the member.
Uh,
Every conversation in healthcare, when it comes into the payer network, there has been an incident. So that you need to build advocacy for the member to ensure that you're solving for their problems. And that is the most important capital allocation we're doing internally in our company, the way we train our employees, the way we train people that are directly in the front line talking to our members, our customers' members, is around building customer advocacy. It's not about scenario building as to what happens. A Wall Street fund manager could have a very different advocacy requirements than a pensioner living in South Dakota who's widowed or who's single. They're very different requirements. So building the right advocacy and ensuring that that permeates in the culture of the organization is the most important element. And once we get this right, working with our clients, it then starts showing up in our client star rankings. It starts showing up in all the measurement criteria that our clients are measured from their stakeholders, their boards, the shareholders, and the regulators coming to it. So to your point, 3 months back, we thought that we were in a settled world, and now it's different. The changes are so rapid. And regulation actually also provides the guardrails where they are acknowledging the fact that the opacity which we have seen historically before the advent of the ACA and how things are playing out is the person that get affected the most is the member. You have pharma, you have payer, you have providers, and you have the member. And in this equation between payer and provider, the member gets affected the most, and they have no leverage because it's the smallest unit in that whole ecosystem. But focusing on the member and putting them at the top of the channel in terms of how regulations are also helping in driving a level of transparency I think will ultimately, for service providers like us, for our customers, that is exactly where our focus.
Interesting observations. One of the dichotomy we have seen, and especially plants probably struggle with this the most. Historically, a lot of plants are thought about regulations at the opposite spectrum from experience. They think about regulation as a way to ensure things, and it becomes a cause. It becomes a shackling of sorts, which prevents them from driving better experiences. But what we are now starting to say, and what you're also referring to, is how can better compliance, better regulations actually enable better experience? It allows you to have the right guardrails. So how do you think plants or other entities in the ecosystem need to respond to these regulation experience kind of conundrums?
The point is, I mean, this industry is regulated. And regulations have become a lot more complex given the complexity of how, you know, plans, proposals, products, and designs are created. But ultimately, what is ubiquitous is creating a customer experience which then cuts across the realm of what any regulatory framework would be. Because again, the heart of the success is always you take care of your members, everything takes care of itself after that. So, if regulatory frameworks are changing, customers that are more agile to ensure that they use regulations and the frameworks as an ally to build the right capabilities that then drives the right behaviors. Sometimes it also requires a cultural metamorphosis. I think they are the ones that are going to get a bigger part. So, the larger the company gets, sometimes it becomes difficult to drive some changes, but companies that have figured it out, and you can see that they're winning disproportionate market share in the marketplace than others that happen to use regulation and said, this is something which is going to exist. Regulations are here to protect the players in the market and the member being, the smallest one. And if you embrace that change and you reorient the culture in the organization, everything from operational swim lanes to the technology stack to the products that are designed, I think they are the winners.
If you really think about it, right, what we are saying here is it's easier to think of compliance or regulations as a way to build trust. It's the opposite end of that, right? So it helps me build a better trust with my members because they know that I'm following the standards, I'm following a certain guidelines and guardrails that are put into place to protect the members, as opposed to think of as a way where regulations prevent me from doing the things I need to.
Spot on. I mean, to a point, it's like a member should never even look at what the regulatory compliance framework is. Their affinity to the brand is because of what the brand means to them from their experience. And that happens, I mean, a member is not savvy enough to know what are the 100 different regulations that they need. I mean, they get thrust upon the impact of the regulation, like we've seen in, for example, in this big, beautiful bill. But at the end of the day, it's for them to stay with that
Yeah.
plan. It's up to the plan to make it easier so that even the lowest common denominator is able to understand what it means for them to take care of themselves with the plan they were associated with.
Let's unpack the experience piece a little more, right? So we're in the age of technology and AI, right? There's not a conversation that ends these days without AI being mentioned. So what does experience mean in that conversation, right? How do we enable better experience with all these tools, all these technologies that we have available? And the reason I'm also asking this is one of the most common question that gets asked in industries like healthcare is why can't we replicate the experiences that exist in an Amazon e-commerce kind of a world? Why can't we have the best experiences in travel sector, right? What's preventing healthcare from getting there? So how do we use the technologies and tools we have to deliver the kind of member experience journeys we're talking about here?
No, absolutely. Again, it's this industry has been around for such a long time that you're also a prisoner of some of the legacy systems that you have to deal with. And at the end of the day, I won't get into why can't they become, like a born digital. These companies were not born digital. Some of the more consumer tech companies today are born digital. So their architecture today is very different. But you try a born digital company, try and deal with them with somebody who's a baby boomer. The experience could be very different compared to how healthcare systems are wired. But what will enable healthcare system in this age of AI, in this age of, what is the art of the possible, is try and make customer journeys inelastic, which means that end to end of either categorized by a socio-economic category or by an age category or whichever is the categorization you look like, if you make those customer journeys inelastic, so you allow a single provider or a few providers to get an end-to-end view as to what that customer journey is, which is on the back of data, allows them to go in and make insightful analysis of the data that comes out and drive an AI agenda which is right for that customer. Right now, between the fact that a lot of the clients have been acquisitive, there's multiple systems, there's no common system that talks, the data is in several places, the data lakes are not clean enough for action to happen, but the pressure on cost is very high. So what happens is sometimes you have patchwork AI strategies that come out that don't yield the ROI, and then it goes back to a labor cost arbitrage. So somewhere, if they embrace inelasticity of customer journeys and then embrace a human at the helm approach, because given the complexity and the nuances that are prevalent in the healthcare industry, it doesn't lend itself to 100% agentic AI architecture. You need a human at the helm and AI as a tool that supports them in driving the insights of a customer journey, which hopefully, when it becomes inelastic, drives superior outcomes, and then it reflects in all the good things of retention, reducing churn, better star ratings. All those things become the end result.
Since you mentioned about the whole agentic AI architectures, let me ask you this. Uh, when we think about implementing any new technologies, right, agentic is probably the newest one in town right now. One of the most common thought process that comes to enterprises is, hey, this needs to be a more at an enterprise firm-wide level. I need to have my data strategy right. I need to have my security and infrastructure right. And then I'll think about the use case side of it. But what's different this time with agentic is that a lot of organizations we speak to don't have that kind of patience. They want to get maximum utilization out of agentic faster. And they don't have the time to invest in those big journeys, which can often take years and in some cases decades to implement. So how are you seeing clients kind of respond to it? What are the tips that they're using in terms of getting value out of agentic without having to wait for years?
Brilliant, brilliant question. So the way we see this is to break down the entire process into smaller parts, so that you don't have to boil the entire ocean and then get frustrated because the return on investment is not proportional to the return on time in relation to the outcomes. So breaking it into smaller parts, and then making sure that the right approach of what is, there is a complete human approach. There is in some parts you can use machine learning, which should be enough. Some part it gets to AI, human at the helm, and then certain elements lend themselves to an agentic, whereby you can control with proper guardrails. You can ensure that the level of output that you can drive doesn't need a human intervention. So so there are point solutions that need to be broken up, and the best ROI comes when organizations are able to. So that's what, when you get the inelasticity of customer journey, you can then break down where the impact can be the most significant. Today, I think we have a clearer view where agentic will work. 2 years back, we didn't.
Yeah.
So you had to spray a lot more and then figure out where what will work and what won't, and that will keep getting better as the evolution of time happens, and also as cost of technology also needs to fall to really give the arbitrage of replacing a human with the outcome of technology, which then determines the ROI.
That's a very interesting point, because I think a lot of the early skepticism of AI was also about some of the cost angle, right? It's not cheap to implement AI or agentic or any of the other architectures, right? But what's happening is with every month, every quarter, the cost is coming down, right? The ROI use cases are getting better and better. So on that note, what do you think needs to change in the industry to be able to adopt some of these technologies better? And I'm not just talking from a technology evolution perspective, right? There's also changes that need to happen in our behaviors. Either we as members need to evolve, our regulatory standards might need to evolve, we as organizations need to move faster We need to think of it in more bite-sized pieces, maybe instead of more monolithic long-term projects. So what are some of those big changes that you think needs to happen in industry before AI and any other form of technology really takes off?
In a perfect world, in a utopian world, right? If all the healthcare providers contributed their data to be trained, because 70% of the issues are common. Then there are 30% which are unique to each customer. Either the blues will have a certain rhythm. There are pairs that have less than 100,000 members would behave differently. The nationals would behave differently. But 70% is the same. The customer journeys are largely the same. Now imagine if all of them are able to provide the data, assuming the data is clean. That's again a big assumption. The data has to be tagged. It has to come and fall into some swim lanes. And if all that goes into and if you start training this large language model, but you don't have to raise $100 billion to do it, and you do it at a fraction of that cost. I mean, there will be a time when it happens. And then from that utility, you create the smaller language models that are relevant to each one of the customers for them to differentiate. But you're not taking away the competitive advantage of how these people compete with each other, but then you're solving for an industry issue of trying to make those customer journeys inelastic and make it a lot more relevant up to a certain point, up to a certain segment, the way you want to look at your customers, be it, as I said, in the age zip code or in the income zip code or, where they are. But after that, if that happens, then there is truly a democratization of data within a Fort Knox environment where the data gets trained, and then it should bring down the inefficiencies in the segment by such a large magnitude that it then puts the power back into the member. It then keeps the payers, they deal. So it just, as I said, that's an utopian world, right? I mean, it's very difficult to get there, but the steps that at least people like us at ResultsCX, what we're trying to do is we're taking baby steps and picking those, to your point, where in those segments where it lends itself to an agentic AI, to where I need a human definitely in front of having that conversation, and in that continuum,
Yeah.
which of these models lend, and anything which is agentic will lend itself to to a small language model being trained, which then allows for the application to automatically happen and solve for the issues.
Since we talked about AI, what we haven't talked about today is the human side of it. So one of the most common ongoing debates is what's AI going to do to the workforce, right? There's a whole sort of socioeconomic challenges we need to deal with. There's a whole sort of retraining initiatives that are going on. So when you think about healthcare and all the complexities of healthcare, what does it mean for people, our employees, people who are working in healthcare industry? How do you see them kind of responding to these? What evolution do you think is afoot for the workforce in healthcare?
I can do a crystal ball gaze for the next 12, 18 months because I know how technology, what the impact it's having and what's going to happen. But if I take a look at the next 2 years, I think the fundamental requirement for a persona-based training for the agents, which I said, a Wall Street hedge fund manager would need a very different persona, compared to a baby boomer. So you need, and underlying both is a common thread of empathy, because the industry is such, it's not like a food delivery where it's not a pizza delivery. There's something which has happened. I mean, when there is a contact coming in regarding a claim, somebody has gone through an event. So the underlying empathy is required, and the most important part is not all the conversations stick to a script. Lot of conversation requires nuances which are so complex, which ultimately lead to the outcome that you want to drive. But the human empathy required to understand the reason as to why somebody is engaging in a certain conversation ensures that the persona-based training, which then drives human advocacy in understanding the problems and solving for it, I think AI is still some time away. So that's why the human at the helm becomes extremely important. Can AI understand empathy? Can they understand scenarios? Can they sometime in the future? Yes. But is the world going to be static sometime in the future? There'll be new challenges at that point in time. So hence we believe that at least in this industry, the human at the helm is going to be important, and understanding the customer's persona rather than understanding the scenarios that can play out irrespective of the persona, which is what is now being discussed. That pivot is going to be extremely important to drive a higher level of NPS to ensure that the churn rates are lower of the members with our customers. And then if our customers take care of their members, everything else takes care of itself.
Absolutely. Couldn't agree more. I'm glad that we finally got a chance to connect and just dish it out about healthcare. There's so much that has happened, so it just helps to kind of exchange those thoughts and ideas and just get it out.
No, thanks, Manu. And you guys have been at the forefront of getting a lot more intelligence from the customers. And as much as we execute on it, some of the thought leadership as to what's happening in the boardroom with these customers becomes very important insights for us. I enjoyed the questions today, and let's exchange notes again in a couple of months and see how things go.
Hopefully not this disruptive, but I'm not counting on it.
Thank you. We appreciate it.